Hi, I'm Dr. Michael Abernathy, and I'm sending you this short video, well, because Max and I were sitting and we thought, our doctors need some help kind of getting centered, kind of figuring out what their true north is, and start acting on some things before we get back into the offices, however long that might be. And so we sent out a blog every week, and our last blog, at the end of it, we had a suggestion. If the audience that was listening to it, if they were interested in doing this, we'd be glad to do it. And our suggestion was this, is that we create a very short video, maybe 10 to 15 minutes at the most. But in that video, it would have 3 different topics, 3 different areas that we touch on. One was something to act on right now, something you could take, and while you're at home, if you run down the office, whatever, you can act on it. It's going to make a significant difference when you get back to your practices and get your practices going back the way they were. Secondly, was kind of the plan or the information, like learning one thing, okay? Understanding what that act would get you. And the last was a goal. It might be a goal for this, or maybe a goal for the next thing we talked about. But just short, 1, 2, 3 or 4, 5 minutes on each one of them, and then whatever we need to give you to act on it right then. Now, the easy way for us to do this is to use the revised Super General Dental Practice book, which you can get absolutely free if you just go to www.supergeneralpractice.com and download a copy of that, because we're going to refer to it. Now, there may be other things that we could send you at some point if it's not in the book, but initially we'll keep pointing you back at the book, because I think it's the best thing you could look at, read, and actually implement in your office to recover from anything, okay? Now, in this last blog and on our next blog, we're going to include a link to 6 different articles that I wrote about 6 months ago. They covered actually 6 weeks. And they basically were gathered around self-diagnosing yourself. So before we start doing these seminars where we give you one thing to act on, one thing to learn, and one thing to set a goal for, to plan for, we want you to actually know exactly where you are now, okay? So each one of these, 6 of them, might take you, 2 or 3 days to go through, maybe a week if you're slow. Your staffs aren't going to be there to help you, but it's important that you actually know exactly what 2019, or when things were going well, what that looked like. And now we're going to use that data to show you that even at that level, maybe there were some improvements you could make. And by making the changes that we're going to ask you to make, you should recover very quickly. You're going to be the small group that actually acts quickly and takes back your practice.